Recovery after a reverse total shoulder, which is when we basically swap the ball and socket around. And the most common reason we do that is in a patient that already has a rotator cuff insufficiency or they have a chronic cuff tear. Because again, without the rotator cuff intact, a regular anatomical replacement won't work. It won't stay in place. So the reverse has really been a godsend for us as surgeons and for the patients with rotator cuff tear arthropathy to really give them pain relief and functional recovery. The recovery with the reverse really depends on whether or not any of the cuff is repairable. If I can repair the subscapularis, which is the rotator cuff in the front, then we treat it basically the same as an anatomical replacement. 6 weeks in the sling to give that the best chance to heal. But I would say the vast majority of folks don't have a subscap in these situations. And I usually keep you in a sling for 3 or 4 weeks, and that's it. And then we start moving. Again, folks take a while to get their strength and function back, but pain relief is usually pretty good, pretty quick. And again, the vast majority of the patients, even as early as that first follow-up appointment, tell me they have less pain than they had before. So the reverse is definitely an easier recovery just in general, but I still believe that anatomical replacement is the way to go if you have an intact rotator cuff.